My name is Dr. Hadi Manji, and I'm a consultant neurologist at the National Hospital for Neurology here in London, which is really a center for neurology in the United Kingdom. So the reason I became a doctor was really by chance. I was born in Kenya. My parents were never educated, and we were at school, and the teacher was going around the class sort of saying, "What do you want to do when you grow up?" And in panic, I said, "I want to be a doctor." And really that was left with me ever since. And I think it was almost by chance that I mentioned doctor, but it was the right thing for me to become a doctor because it suits my personality. And then after medical school, I didn't know which specialty to be part of. So I became a general practitioner. And here in the UK, what happens is that you go and train in medicine, obstetrics and gynecology, pediatrics, accident emergency. And so I did that and became a general practitioner, but then decided it wasn't for me. And then I went back to medicine. I was going to be a gastroenterologist, didn't like it, and ended up in neurology because, again, by chance, I was doing a job which I enjoyed. And the most important thing is that it suits my personality in terms of the interest I have in neurology, which is it's an academic subject, but it suits my personality. And so I'm very pleased that I've become a neurologist because it's made me very happy over the past 25 years. The most important thing, I think, if you're a doctor is that you do need to like people, you need to enjoy being with people. And neurology, out of all the specialties, is really the most clinical of specialties because what you have to do is you have to take a full history. And sometimes that takes 25, 30 minutes in a consultation, and you examine patients. And so it is like being a detective to find out where the problem is in the nervous system. And then through experience, you work out what the underlying cause is. So for example, somebody with headache, 95% of patients will have a normal MRI scan, and you have to make a diagnosis of headache on the history and your experience. And so that is what I find most interesting as a neurologist, and that's why I enjoy seeing patients.